we have some folks here who've been affected by United Health Group. I talked a little bit about the amount of money that they make. There are some people who think the way that we fix health care is we ask politely the insurance companies to start doing the right thing.
Oh! That really works.
They think that's going to be the way that we can get this done. There's a plan in Congress. It's called No Plan at All. And what that is to get the insurance companies to do the right thing by just asking them. Right behind me right here, you can see some photos. These are photos of the CEO, Stephen Hemsley's home. He has two of them, and how huge and how wasteful it is. This man makes a tremendous amount of money. Yet, he is denying care regularly to Tennesseans and people all over this country. And so, here's what we're going to do, though. We're going to give him a shot. We are going to go, and we are going to ask the people of United Health Group. We are going to ask them, because people say that's the way to fix health care. Okay, if you guys are going to be able to do it, here's a policy we'd like you to adopt. Do you guys promise to no longer get between, as an insurance company, a doctor and his patients? Do you guys promise to no longer deny people care because of pre-existing conditions? Do you guys promise to adopt a policy that doesn't intentionally remove people's care? It's called rescission because maybe there was a typo on the form that they filled out or they answered a question incorrectly. The other side thinks that that's the way that we can fix health care. And so we're going to go in and ask them to see whether or not that actually is what works. So I want to introduce to you someone first who's going to tell you a little about her story. She's a customer of the United Health Group, and she's going to tell you why it's so important that we ask this company to change their policies, and then, frankly, if they're unwilling to do it, that we take action in Washington, D.C. to make sure that every American has quality, affordable health care. And this is Courtney Atnib. And Courtney, if you could just come up here and stand in front of these gigantic houses and tell your story.
Okay. Thank you, Tony. Good afternoon. I'm so glad to be with you all here today, but it's unfortunate that I'm here to tell my story because, like many Americans facing this healthcare crisis, my story is not very unique, but I'd like to share it with everyone today. My name's Courtney. Like Tony said, I'm a native Tennessean. I'm 31 years old. I've lived in Nashville for about 5 years. I have a 14-month-old baby girl, so I'm a working mom. I love my family, I love my job, and I love my country. When I was in college, I was diagnosed with a pretty radical chronic illness. This disease radically transformed my life. I learned pretty quickly the importance of managing your care and personal responsibility. When I am healthy, I'm a really good friend, I'm a good mom, I'm a good employee, but when I'm sick, all of these things suffer. Over a year ago, I began taking a medication that radically transformed my life. I was so healthy, I felt so good. My doctors were so happy. I have a very close personal relationship with my doctors. Ongoing conversations. We talk every day about ways to keep me healthy because they understand the importance of managing my care. Well, about the last fall, my doctors decided to change my prescription a little bit, up the medication I was taking. We thought this would be a pretty routine procedure, that it would go really smoothly and easily. Well, in December, United Healthcare decided to cut my medication. I knew this was really bad. I knew that things would get really worse, and unfortunately it did. In January, my health started to really deteriorate, and they then decided to reinstate my medication. After a month of my doctors, my family, my employer begging, pleading for them to take my medication and pay for it. This medication was not cheap, and honestly, if I could have afforded it, I would have paid for it out of pocket. But this is not something my middle-class family could afford. So in January, the medication was reinstated, but it was too late. I was on a train out of town. I can remember calling United on a daily basis saying, you understand, if this medication doesn't happen, I'm going to be really sick, I'm going to be out of work, everything's going to go down the tubes. So, sure enough, in May of this year, I had radical surgery. Surgery that put me in the hospital for over 2 weeks, and out of work for 2 months.
You can do it. It's all right.
I promised I wouldn't cry. That's not going so well. This surgery was a result of me being denied care. When I would push United back in the winter why I was getting denied this medication, and when my doctors and my nurses asked why this was happening to me, a middle management person had made the decision that my medication that I had been approved of for over a year was not medically necessary. Someone that didn't know me, didn't know my family, and didn't know my health situation made a haphazard decision that I didn't deserve the basic health care needs that I needed. Well, here I am today. I'm much better. But unfortunately, I'm on a new medication because my body built a resistance to the former one. And if this medication doesn't work, then I'm at a real crossroads in my life. My situation isn't different than most of you around us. What happened to me can happen to any of us. A healthcare company is making decisions for us. One of the basic arguments you hear in this healthcare debate is that people don't want the government making decisions for our healthcare. Well, ladies and gentlemen, they already are. They're making decisions not by your doctor's choices or your nurses or your families or what you want. They're making a decision on what they can afford. And what the most ironic thing about all of this is, it's a medication that's pretty expensive for us to pay for out of pocket, has ended up costing the insurance company a lot of money because they were not appropriately managing my care. And that's what this is about, is that an insurance company that deals in greed and huge record profits doesn't understand that if you keep people like me healthy, I'm a productive member of society, I stay in work, and I'm a good mom. So I think today what we need to say to United is that we're sick of them putting profits over people, and that they need to make a real effort to putting good policies in place that help people with chronic illness. And we need to say no to corporate greed. Thank you.
Amen. Amen. Thank you.
Hi, I'm Carol Westlake, and I'm actually Courtney's boss. I'm her employer. And there's not a day goes by when I don't feel kind of guilty for having chosen United Healthcare as our health insurance plan, may I say briefly. But it's really difficult. I'm a small employer. We employ fewer than 25 people at my office. And finding health insurance is a really difficult thing, and one that is very, very challenging to do and to find on an affordable basis. And I will tell you that we've had United Healthcare insurance for some period of time. And last year, the increase in our premiums was 38%. The year before, the increase in premiums was 16%. The year before that, it was 20%. And so on a steady basis, in my business, we actually have been foregoing raises for our staff. We have been foregoing a lot of different things in our company so that we can keep our employees insured. And that's something that's been very, very difficult, and especially difficult because we have a lot of employees with chronic illness, with disabilities. Myself, I was diagnosed 2 years ago with breast cancer. I'm healthy now. I'm proud of that, but it was a constant struggle to get the appropriate care that I needed, to make sure that I could get back and run the business and keep everybody employed and keep everybody insured. It's been very, very challenging. You've heard today that you know, according to the National Bureau of Labor Statistics, Tennesseans work for an average of $19 an hour. That doesn't go up when all of a company's extra cash goes to providing more more premiums for the same health insurance. We raise our deductibles, we raise our copays, we do everything we can to keep folks insured, but we don't raise their salaries. And with that, the CEO of United Healthcare is making $47,000 an hour. Nobody in my company, I promise you, including me, is making that. And so I am here today to join with Courtney, to join with all of you, to say we do need to put an end to corporate greed. We need a health insurance reform. We need a healthcare system that makes sense, that delivers affordable, adequate health care to people who need it, whether it is unexpected or expected, and that corporate greed should not be what determines what kind of health care people get in this country. Thank you.
Thank you.